Hi, this is Dr. Jessica Hochman. In today's video, I'm going to answer the most common questions that I get from parents about fevers. As a pediatrician, I can tell you there is so much fear and anxiety around fevers, so I wanted to spend some time explaining when they are actually a cause for concern and what we as parents can do about them. So first, let's review the actual definition of a fever. A fever is defined as a temperature of 100.4 degrees Fahrenheit or greater, or 38 degrees Celsius or greater. So I mention this because a lot of parents will tell me, Dr. Jessica, my child has a fever, it's 99 degrees. And actually, by definition, this is not a fever. A fever must be, by definition, 100.4 degrees Fahrenheit or greater. Another common question I get, why does the body actually make fevers? A fever is the body's natural immune response to fighting something that the body doesn't think belongs there. Typically, we see this in response to inflammation or an infection. The body temperature can also rise from being overheated, a condition that we call hyperthermia. Hyperthermia can happen, for example, on a really hot day. Another common question I get is, what does the fever number have to be where I have to go to the doctor? So with little ones, and I mean children that are 3 months or younger, the actual number of the fever matters more because children can be more ill than they actually appear. But as kids get older, the actual number of the fever doesn't really matter. So if they are acting unwell, for example, if they're lethargic, they don't want to eat, they seem like they're in pain, they have a really bad cough, or if your parental intuition tells you something's really not right, I would see a doctor. Here are my general guidelines when I would recommend seeing a doctor based on the fever number alone. First, if your child is 3 months of age or younger and has a fever, so that is 100.4 degrees Fahrenheit or greater. If your child is 3 years old and younger and has a temperature of 102.2 degrees Fahrenheit and greater. If your child has a fever ever of 106 or greater. If your child's had a temperature for 3 days or more, I would see a doctor. But otherwise, there's no real fever number that I would say you need to see a doctor. What really matters is how your child is acting. Another common question I get, is it good to have a fever? Well, potentially so. A fever is our body's natural immune response, and so by elevating our core body temperature, this may be a natural way that we are fighting an infection. So this leads me to my next question. Can fevers be potentially harmful? Well, fevers, especially those higher fevers, can make children feel really yucky and uncomfortable. So in this sense, fevers may be harmful because if your child's not eating or drinking, they're having trouble sleeping, this may make them feel weaker overall. So when your child does have a fever, I highly recommend encouraging fluids and fever-reducing medications like Tylenol or ibuprofen to encourage them to feel better. And lastly, to go over a fear that I hear all the time from parents, will a fever cause brain damage? There's very little evidence to suggest that this is true. Fevers rarely go above 106 degrees Fahrenheit, and it is thought that a temperature must exceed 107 for there to be any damage to the brain or body. Generally speaking, it is the underlying cause of the fever that may potentially cause problems, but not the fever itself. So in conclusion, always make sure and talk to your pediatrician if you're concerned about your child's fever. Second, fever is a normal immune response. It's a sign that your child has a working immune system. And lastly, the overall big picture here is to be more concerned about how your child is acting rather than the fever number itself. This is Dr. Jessica. Thank you for listening. I hope you found this video helpful.